So we have Dr. Singh and Dr. Matossian on, and they are going to take it away. So Dr. Matossian, I know you are on mute if you want to unmute yourself and get the conversation started.
Perfect. Thank you so much, Angelica. I am Dr. Cynthia Matossian. I'm a board certified ophthalmologist and the founder of Matossian Eye Associates with a huge passion on dry eye and refractive cataract surgery. I am delighted to have a co-host here, Dr. Rishi Singh. So, Dr. Singh, can you please introduce yourself?
I'm Dr. Rishi Singh. I'm a staff physician at Cleveland Clinic, Martin Hospital in Cleveland Clinic, Florida. I am part of the Medscape Eye Care Advisory Board, as well as Dr. Matossian. And we are here today to talk about the American Ophthalmology meeting that took place in Chicago, Illinois, and talk about some of the most important studies. There were so many studies presented there that were really impactful for eye care from many different specialties, obviously. And my focus is retinal disease and retinal areas. So I will focus on those as my starter. So I guess my biggest takeaways from the AO meeting this year has been really in and around a couple of different advances in geographic atrophy. Age-related macular degeneration is a complex disease. We've been taking care of it for so many years in the form of wet macular degeneration or exudative AMD. That form has been treated with anti-VEGF therapy for many years now, 16 or 17 years since that's come around. And it's really led to a lot of great advances in that condition, allowing us to treat patients and get vision back. The other side of the coin of that is the patients with advanced dry macular degeneration or geographic atrophy. This is a population of patients that's essentially been untreated for many, many years, and we didn't have any treatments for these. We have any treatments for these patients up until just recently. We started investigating various opportunities. Two of the biggest, I think, opportunities are in and around alternative complement inhibition and gene therapy. And we saw some studies from both of the alternative complement inhibition pathway as well as potentially gene therapy, again, addressing the alternative complement pathway in a different fashion with some really good results. The first was the Apellis studies. So Apellis has a drug called pegcetacoplan, and I presented the 24-month data of the studies, which showed a decrease in the growth of geographic atrophy in these patients with every month dosing or every other month dosing. Really with good outcomes at 2 years and showing a significant percentage of reduction of growth over time on the range of anywhere from 18 to 20% reduction over that period of time across the group study. In addition, one of the other areas we looked at was functional vision outcomes. And the unfortunate thing was the study did not show functional visual improvement. And that might take years to show for patients because vision is a lot due to many different functions, facial recognition, reading speed, other activities of daily living that we can measure, sometimes not objectively, but yet we see the growth is significantly decreased with that over time. And so that's an impressive result. They have a PDUFA date in November this year with the FDA. I suspect they will get their approval for the drug and should lead to some meaningful improvements in our patients over time by reducing geographic atrophy. One of the concerns with that study was that there was a rate of conversion to neovascular AMD in those patients who would receive this drug. Again, the percentage rates were around 8 to 10%, depending on what arm you looked at in the study. That's a significant amount, and we need to have those crucial conversations with our patients if we're going to consider this therapy when it does come out, that patients may be at risk for developing these sort of adverse events from the drug if that drug does become approved. The second study that came out was the Gather-2 study. This was, again, Iveric Bio, which had a drug that is also abacastinib. It's a drug that affects C5 in the alternative complement pathway and showed similar reductions in GA growth and also similar conversions to exudative macular degeneration. So again, very foundational for our understanding about getting a drug in the alternative complement pathway to decrease geographic atrophy, which is potentially first in class, but at the same token, having the same effects of conversions to exudative macular degeneration. And so that's obviously the concern with the two drugs, but yet they look very similar. I suspect both of them will achieve the ability to get approval for the drug. But we'll have to see how it gets used or how it gets used in clinical practice and how those crucial conversations kind of play out.
Wow, that's a
The
lot of
last drug that I think
information,
is on the
Dr.
gene
Singh.
therapy route was impressive was Hamero Biosciences, which was now acquired by Janssen Pharmaceutical and J&J, had their readout of patients 18 months into receiving the intratherapy for gene therapy. And what this gene therapy does essentially is affects the alternative complement pathway at the level of C5 to C9 attack complex. And this study again showed some significant reductions in growth over time with similar conversions to exudative AMD over that period of time as well. So it wasn't without its side effects, yet did show potential benefit at reducing growth with a single injection versus having multiple injections, as was done in many of the studies we just talked about. And that's one of the concerns about any of these trials, is that frequency of treatment is always a problem in our area. We really suffer from durability in many of the therapies that we have available in both wet and dry macular degeneration. So there's a lot of focus on that at the meeting this time around to kind of look at that and figure out what the opportunity was.
Awesome. Thank you so much, Dr. Singh. And I know that Dr. Matossian has joined us.
Oh,
So
great.
I will hand it over to also Dr. Matossian to go over anything that she saw at AAO. Would you like to go ahead?
Absolutely. Yes. Can you hear me now?
Yes, we can.
That's great. Dr. Singh, that was a great wrap up of a lot that's happening in the ret space. Some of my biggest takeaways from AAO. First, it was so wonderful.
Are you?
I can hear both of you, so it probably is just something on the receiving end. Sorry, Dr. Singh. I will point to you, though, Dr. Singh, once Dr. Matossian has. Yes. So go.
That's great. Dr. Singh, that was a great wrap up of a lot that's happening in the ret space. Some of my biggest takeaways from AAO. The first takeaway was it was so nice to have an in-person meeting again. I recall when the AAO was, rescheduled and not held a few years ago because of COVID. So it was wonderful to have that in-person interaction with colleagues, with industry, and with, national ophthalmologists. One of the biggest topics that was resonating across lectures, across the exhibit floor, and in informal conversations among one another was staff shortage. It's truly epidemic, and it's so bad that it's impacting the level of care. It's impacting the number of patients we can see comfortably in a day, and the diagnostic procedures as well as therapeutic procedures that we can perform for our patients. So, staff shortage was a very commonly discussed topic. Another kind of big takeaway for me was drug delivery. Um, Even though we've made huge improvements and strides in the types of medications that are available, unfortunately, for example, anti-VEGFs for macular degeneration, what Dr. Singh was referring to, still require injections on maybe every 4 to 6 to 7, 8 week basis. Of course, the frequency and timing is specified. For ophthalmology, for the front part of the eye, drops still have to be instilled. Patients struggle with putting drops in their eyes. It's not as intuitive as it sounds or as simple as it is, especially for people with arthritis, Parkinson's, or tremors, memory issues, and forgetfulness. So, alternative drug delivery for the front and back of the eye was also a big hot topic.
Thank you, Dr. Matossian. I appreciate your insight on what you took away from AAO. Dr. Singh, what are you most excited about being part of the Medscape Eye Care Advisory Board?
Yeah, I think we know that there's a lot of opportunity to educate those in our field with the newer studies, technologies, devices, drugs. We just have every week something new coming out in retina. I'm so blessed to be in this field. It's a big change from when we first started. We had one drug, one therapy for almost every condition. It was steroids, and now we have so many different opportunities. So I hope, as part of the Medscape Eye Care Advisory Board, to be able to deliver some of that cutting edge information, either through didactics, through case studies, or even through webinars.
And for me, I'm honored to be part of and on the board of the Medscape Eye Care Advisory Board. Medscape has such huge potential to reach patients, to reach folks who may not even be going to an eye doctor, direct to consumer information, as well as to other physicians and care providers and ophthalmology and optometry colleagues. So it's a wonderful means of disseminating information so all of us can stay current and be able to do the best we can for each and every one of our patients.
Thank you, Dr. Matossian and Dr. Singh. Appreciate your insight on that. And for a final question, where can people reach you or look at your studies? So I'll start with Dr. Singh. Where can people reach you or look at your studies and find more information?
Yeah, I tend to use a lot. So I'm social media semi-savvy between Twitter and Instagram. So you can follow me at Dr. Rishi Singh on Instagram, or even on Twitter. I'm on at Dr. Rishi Singh as well.
Thank you, Dr. Singh. And Dr. Matossian?
And for me, I have it. You can follow me on Twitter as well as LinkedIn. A lot of my articles are published in PubMed, and or if you look for under Matossian, Matossian, as an author, Cynthia, you'll see a lot of my published peer-reviewed articles.
Awesome. Thank you both so much for taking the time today and for, explaining to our audience about what's new in eye care. We hope to see you again soon on Medscape CME for more information on what's new in eye care. And if you have any questions, just tweet at us and we will get back to you. Thank you and have a great rest of your day.